You're listening to another episode of All the Bees with me, Dr. G, and my scrub tech, Bree. Hey, everybody, I'm Dr. Kat Gallus, and you're listening to All the Bees, the unfiltered plastic surgery podcast that also covers important celebrity news. And I'm joined today with my co-host, Bree. How's it going, Bree?
Good morning. Good morning. Happy October 1st. It's pumpkin season.
Yes. My youngest daughter was like, this is my favorite month of the year.
Oh, yeah. I've already got all the pumpkins at my desk. My house is full of pumpkins. Everything is about to be pumpkin spice.
She said it's a perfect temperature. It's not too hot. It's not too cold.
I love that.
Halloween, which we all love. Yeah.
Spooky season.
Mm-hmm. And it's still warm, obviously, because we're in San Diego. So
I know.
Today, we're going to be talking about Motiva breast implants. But as usual, we'll kick off with some celebrity news.
The most important stuff.
We'll briefly go over the John Mulaney. I can already hear my sister going, I don't really like him. That's what she says. I was like, he doesn't care. Anyway, there's a lot of...
Do I even know who this is?
He's a comedian who must
not be that funny if I don't know who he is.
I think it was... He's one of those guys who's always the SNL host, and you're like, he's hosted like more times than most people for SNL, and people are still like, who is this guy? Anyway.
I guess that tracks because I don't watch SNL.
Right. He's, everyone's like, did he get jaw implants or jaw surgery? Kind of very Zac Efron-y. I think in his case, actually, I read the story, and he has a history of rehab, a history of drug abuse involving cocaine. And he talks about how when he was withdrawing, he ground his teeth and broke some molars. And so I think it's probably he had dental restoration, because they actually kind of tap into somebody in the article, a dental person who says, yeah, you can do restoration, and it's a subtle way of like flushing out the jawline. I feel
he's
his
not
face
giving.
looks wider. Yeah. We're not talking Brad Pitt level concerns of what's going on. He could do filler like most of these guys have fallen for, but I feel like the more reasonable explanation is cosmetic dentistry, which, we don't cover a lot on this podcast because we don't know shit about it, but I mean, he's clean shaven. He's got like brighter lighting. His hair's totally different. I don't know. His eyebrows are the same. One. Yeah, his face is slimmer on the earlier photo, but it's legit like 7 years ago, so it's not like that. His hair's longer in the second photo. Womp womp.
Yeah, he doesn't give me maybe like he doesn't even look like he just had a lot of filler.
No.
Maybe in his cheeks he looks like he's got some volume, but
well, that's the whole concern is like his lower face is that did he have an implant? But I feel like more likely he had some cosmetic dentistry. So just as
a side profile.
I know. I was like, one view, no view. Like I need another view, but it's fine. That's about all I have to say on John Mulaney. But more interesting, which also if you do a deeper dive is, I don't know. I have some questions as always, is this horrible article about this girl who died. And I can't tell, like, okay, so she had a secret boob job and liposuction. That's awful, right? Like, I don't know why you would treat your almost 15-year-old to an augmentation and a BBL.
Did her mother know?
Her mother set it up. Her mother is a nurse for the plastic surgeon who did it. And the plastic surgeon who is in Mexico, but an actual plastic surgeon, is suspended. And then she died a couple of days later, and the mother never disclosed to the father that she had any surgery and had COVID or something. And that's why she died, which seems nuts that all of that would get missed.
See, that is crazy. And how did she die? I just have so many questions. Right. And why is this her 15th birthday present?
It's like Sweet 16 in the United States. It's the quinceañera. But yes, it's an inappropriate birthday present for sure. I mean, it sounds like she definitely had the surgery. It seems coincidental that she would die a couple days later from respiratory failure. So one imagines that it was like less likely COVID and more likely a pulmonary embolus.
Okay, so those are the parents?
No, that's the plastic surgeon and the mom. The mom is the girlfriend of the plastic surgeon.
What's on her nose? That is just...
I don't know. An implant.
That's just crazy to me.
Yeah, it's sad. I have to draw a line somewhere, and for anything that's like strictly cosmetic enhancement, I think you have to be at least 18, you know?
Yeah, that's just...
A lot of the other things we do on teenagers, like breast reductions and labiaplasty, I think are functional. So that's not, you know, but we're not doing breast augs.
I want to know
for this person?
Yeah. How often do people die? Like, is it just a coincidence that the girl he operated on, his girlfriend's daughter, just passed away?
I mean, I think usually when you're trying to do things under...
The detective mind in me is brewing, okay? I have a lot of things that I could say that I'm not going to. But
I just think, why was she in the hospital? And then she was in the hospital for a couple of days, but the father was never there at the hospital. I just, like, what happened? Like, he waited until the funeral to see her and then was like, wait, she looks different? I don't know. There's a lot going on here.
Like, hold on, she just had surgery?
But he didn't know. So he's saying she was in the hospital, she died, he goes to her funeral and is like, why does she look different? But I'm like, when she was in the hospital, you weren't there? I don't understand. Like, you have to wait until the funeral before you actually see her? Like, you wouldn't rush to the hospital to see your daughter?
Right.
While she was on a ventilator?
Makes sense to me.
In the week after the surgery. So she was in the hospital for a week. I guess I'm confused as to why you wouldn't see her in the hospital and be like, oh, that doesn't track. Right? Oh, they're saying that the hospital covered up the fact that she had surgery, but I don't know.
Don't put implants in your girlfriend's daughters.
Who are 14.
At 14. Ugh. Like,
first of all,
at what point do you say no?
Your breasts are still growing. Like, they're still growing. It's nuts.
Right.
Okay, so speaking of adults making decisions about their own bodies and elective surgery, we have Cardi B.
Cardi, I love her.
She's awesome. She went on the Call Her Daddy podcast where they have chairs and sit in a room.
We're going to get there. But all we need is a little espresso martini and some velvet chairs. And I have a vision. Okay.
I am not drinking an espresso martini, for the record.
You can have a pickle martini.
That sounds good. Okay. So she's talking about her butt reduction surgery. So she's famous for her booty, which she said that she might have made too big and then turned around and had a BBL reversal. But then in usual fashion, she can't really explain what any of that means.
Is it all fat, or did she say she had butt implants?
She said she had injectables and a BBL. So I don't think she had implants in there.
Okay.
She never says the word implant, and she doesn't honestly look like she ever had implants. It really does look like fat. Also, she's pregnant with her third kid. So the amount of changes that you have, like gain, loss, hormonal changes, the pregnancies, the getting back into shape.
Side note, I love her confidence in being the new baby mama to this guy, but this guy has fathered 2 other children in the last 9 months. 2 other girls just had babies. And Cardi B going through a divorce, like, anybody would be, lucky to have her. And then she picks some douchebag who's on 3 babies in 1 year.
Yeah.
I don't know if he's a douchebag. I'm just saying, come on.
I'm sure he is. He was quoted famously as saying her BBL smells, which she was like, I don't know what that was all about because my BBL doesn't smell. And I agree. Why? That was such a weird story when it came out. But yeah, this moron NFL player, she's like, this is not.
No. Come on, Cardi.
Ooh, I feel like she has Vivienne Westwood jewelry on, though, which I stan. Anyway.
I love that you know that.
I think she's wearing his jersey, though, right? That's the whole, I'm going to not claim to know anything about football, but I'm pretty sure that.
The Patriots?
I mean, we're here for your plastic surgery information. Don't start talking NFL to me because I'm going to fail.
I cheered on at my girlfriend's team last weekend on Saturday, and it turns out the whole first half I was cheering for the wrong team because they were both wearing red and white, and I was very confused.
Yeah, I feel like they all do some variation of red, white, and blue, or white and blue, and you're like, can you guys come up with some original colors, please?
Yeah.
Please. So Stefon Diggs, I'm assuming he plays for the Patriots then. I would hope so, if that's what she's wearing.
Maybe she's sending a message. Maybe it's his rival team.
My husband is like flinching right now. God, how does she not know the basics?
Men are rolling around in their graves. But I do know who Travis Kelce is now.
It's Kelsey.
Okay.
You know one football player. Great. Okay, just to confirm, all of those who are screaming at the podcast right now, Stefon Diggs plays for the Patriots. But more importantly, he just had 3 babies in 1 year with 3 different women. So I feel like that's all you really need to know. That's the only stat you need, honestly, to know that this is not a lasting relationship.
Right.
But maybe she doesn't want that. She certainly doesn't need it. She can do whatever she wants.
That would be so good if like you have their stats like height, weight, birthday on the right side. You add how many children they father.
Yes. I think they should add that.
That'd be so good. Salary divided by 13 children.
maybe Patriots is, Tom Brady famously had, like, come on. Maybe that's part of it's cold up there.
So good.
Okay. So moving back to her actual surgery, she talks about this BBL reduction, which in my head is just liposuction and maybe taking in some excess skin if they overdo it. But she says that it was a lengthy process and that she was bedridden. And I'm like, what? You're not bedridden after any like you can do a total hip replacement these days and we want you to get up and move around. Like no one's bedridden, man. Nobody. So I don't really know.
She says I have to literally sit on a table, get cut from the bottom, get cut from the top, and be on bed rest for 3 months. I'm very confused.
Yeah. So I don't know what procedure that was.
Is she like
a butt lift? I don't know. And even so, like, again, the recovery is not 3 months of bed rest. Yeah. So she's like, I would like it to be smaller, but I don't want to do any more surgery with it. I learned to live with it. I'm like, well, you're going to go through another pregnancy. So just kind of see where it lands there.
Well, it sounds like she's saying, I'm not going to put myself in that position again because you don't like my body. Like, screw whoever doesn't like your body. If it's Mr. Stefon Diggs, whatever, like, peace out.
Yeah. Yeah.
Like,
I think
ridiculous.
Yeah. I want it bigger. I want it smaller. Just do what you want to do. It's wild.
Do not change things about you for a man.
Yeah. That generally doesn't work out well.
Cardi, if you're worried about a man not liking your butt, that guy in the back of your pic on staff, I think he's fine with it.
Yeah, he okay.
He'll
he's good.
He's good with it. Baby daddy number 4 or 3, I don't know, whatever. You'll be fine.
I believe we have some additional stories to cover before we move on to Motiva. So let's get through them. Before we talk about implants in general, let's talk about the blepharoplasty bun.
I want to do this so bad, but I have extensions and I can't. Anytime I put my hair up, you can see it.
You know, I wear my hair in a bun half the time anyway. I just don't wear it like if I'm going, like I would never wear it out because
I'm going to do this for our next podcast and see.
It does give you that little snatched upper, it just gives you pull. So a lot of this is talking about how doing that super tight pulled back, either ponytail or bun, gives you a eye lift or
in a migraine.
Facelift. It can also give you traction alopecia where your hair starts falling out at the front line. But if you wear it like that all the time, which I think is going to be Ariana Grande's problem. But for, Anne Hathaway, she wears her hair down sometimes. Same with Selena Gomez, same with Lindsay Lohan. But if you want to look extra snatched or make people wonder if you had a facelift or didn't, then pulling your hair back in a slicked bun is nice. Brows and eye corners. So if you want a quick, I want to know what I would look like with a upper bleph and brow lift, then pull your hair back. If you want to know what you would look like if you weighed 70 pounds, pull up a photo of Ariana Grande.
Oh, Jesus. She's too skinny. And I'm all for being skinny. But she's
she might
unhealthy.
Burger.
Yeah.
Okay, so that was the bleph bun, which came across my feed, and then it came across again. And I was like, okay. I don't know if that's going to just become more popular, the blepharoplasty bun, or people asking for an upper bleph. But anyway, you heard it here. And then our next fun little article about plastic surgery is Alyssa Milano got her breast implants removed.
I'm letting go of the body that was sexualized.
Peace. But I do think what was balanced about Alyssa Milano, who I like, is that she felt it was necessary for her to be attractive, to be loved, to be successful, to be happy, which we said just 5 minutes ago, don't do it for anybody but yourself. I mean, I'm sure it's extremely hard in the entertainment industry to not be doing things for the
how you look.
Yeah. I was trying to think of
and
what the fancy word for that is.
You don't have a word in your armamentarium?
I don't. I can't think of it. Okay. It's on the tip of my tongue. But anyway,
she's just so gorgeous, and she's a great actor. And I just feel like her boobs should not justify being beautiful.
Right.
She is.
But I feel like the best part about this whole article is that she's like, if you want them, I want to be clear that many women will find freedom and beauty in choosing their implants. What is a false narrative for me may be the exact right thing for them. So she's basically like, you got to do what's right for you. And she's not shaming people who have implants. She's not saying people shouldn't get implants. She's just saying, I've had them and I don't like it for me anymore, which is fair. Nothing's more annoying than women in their 50s telling women in their 20s not to get implants because now they're over it. Girl, you got 30 years out of those implants. So don't. Yeah. I think, yes, wisdom comes with age and maybe your lifestyle changes and you don't want the implants anymore. I think I take out a lot of implants of women in their 50s because they're over it and they don't want them anymore. They're not who they were when they were 25 and got them. And maybe more importantly, they don't want to have to go through it again. So they're at that point where they're like, just take them out and don't replace them. I also have patients who are like, actually, these are 20 or 30-year-old implants. So let's exchange them, knowing that I might have to do it again or just take them out at 70 when I'm no longer interested in having implants. It's a different point in time for everybody. Okay, and then our last little bit to cover before we launch into Motiva is the weddings. So,
she looks so good.
This is, I think, a Ralph Lauren gown.
Wow.
Selena Gomez got married in a halter gown made by Ralph Lauren. I think she had 2 gowns. It looks so good. She looks so pretty. The photos were awesome. I mean, slay.
She slayed. Absolute slay.
Yeah. Has her own makeup line to do her own makeup. Pretty awesome. So I would have loved to be at either of these weddings. This one looked particularly fun. I honestly am at the stage where I might have preferred the Charli XCX wedding because it looked insane.
Did it? So, I didn't even see.
Oh yeah. She changes out of that gown, which is also beautiful.
Wait, I'm sorry. The comment, he's so bald, but congrats.
Congrats.
Okay, I'm done.
Wow.
He's so bald, but
what the hell? Rude. This is why these celebrities end up getting stuff done that they don't actually want because they live in the, eye of the average troll. Like, get out. Like, he doesn't know he's bald.
Yeah. That's
People
wild.
suck. I love that everybody else is like, the Marias are on there, Kylie Minogue.
Yeah.
Anywho, after party outfit was, I think, a Versace black bra and a white skirt, which I thought was awesome. And she had trays of cigarettes passed out.
How did I miss all of this?
I don't know. I think it comes up on my popular, my celebrity podcast that I listen to. I'll give a shout out to Who Weekly. So yeah, there are trays of cigarettes with that signature on there in the matchbooks, which I thought was great. Not that I'm endorsing smoking, as you know, we don't, but it's just such a throwback to like the 90s. I can't. So they shouldn't smoke though. It's bad for your skin, bad for your lungs, bad for her voice.
Yeah, don't do it.
All the things. All right, let's talk about Dancing with the Star. Lindsay Arnold says she's so happy with her Og lift. So, I love that Motiva had people get their Ogs done and then talk about it, because she calls out the brand implant in this story. So it's a perfect segue to our discussion with Motiva and why people are telling us that they had Motivas. But I think it's just, marketing, as all things are generally rooted back to marketing. I had to look up who Lindsay Arnold was. Let's just go there. She's a dancer, props, and she got actually, what I thought was interesting about this article is that she explains her decision point, which I think is so on brand with how women make their decisions about breast augmentation. So if you scroll up a tiny little bit, you'll see she was trying to figure out, she had a size range. So when I see a patient in a consultation, I write down size range, right? And she thought it would be 245 to 300 cc's. Fair. And then they come back for the pre-op, and now she's like, maybe 265 to 285, which is really just a more narrow range, to be honest, which is generally speaking what people do at their pre-op. But the fact that she is like trying to decide between something that has a 20 cc difference is kind of wild, right? We have this conversation all the time. It's less than a shot glass. Like, the actual visible difference to your eye is probably going to be a lot less. Yeah. That being said, we did have 205 and 220 in the OR yesterday, and I feel like it looked different.
It did.
Even though...
And we sat and looked at it for like a hot minute.
I know. Even though it was 15 cc's. So I think the other caveat is, if you have no breast tissue, 205 and a 220 are going to look different. If you have breast tissue, a 205 and a 220 are probably not going to matter. And if you have a lot of breast tissue, it's certainly not going to matter. So anyway, I just think it's interesting that she gives us like the inside look at what it means to go to a consultation and start getting wrapped around the axle about what size, 245 to 300. Then she comes back for the pre-op and she's like, actually, I'm thinking 265, but maybe 285. And then this is the part that I hate. The surgeon says, I'll just try them on during surgery and see what looks best on your frame. And I was like, no.
What looks best to him, I'm guessing, is going to be the 300s. Okay, let's be real.
It's going to be the 350. So he agreed, whatever. But God bless him, he put the 265s in, as he should have. Good. Right? If somebody says, I'm leaning towards 265, but you do what's best. Right. 20 years ago, those morons would have put 500 cc's in and called it a day and not done the lift. So at least now we have people who are like, I'm going to do what you want, because anything is going to look good, to be honest, right?
Right. And I feel like that was our problem yesterday, is like when we were trying to figure out the two sizes she wanted, we were like trying to take into consideration the wish pics she had, what she said in her consult, like all the, like there was a lot of deciding factors to which one, because they look, you know what I mean? Like,
right. I start to feel paralyzed, like whatever I pick is going to be the wrong pick for them. Anyway, girl went with a Motiva Ergo, which is their shortened name for Ergonomix, which means it's just a softer touch implant. And she's super happy. She did do a lift. She calls out Galiflex. She had mesh.
Oh.
Yeah. I mean, she like is a spawn con if I've ever seen it. But so she went with the Motiva Ergo. She doesn't say what plane her augmentation was, but maybe she did subfascial because she's a dancer, and then used mesh and also she's hydrating her face. But she looks good, feels good after surgery, and she looks like she's promoting some other stuff while she's talking. She mentions that she had an anchor scar. So she's had kids, so she had a lift, which again, I feel like more celebrities need to talk about their lift because the number of women who I see who need a lift and don't want a lift they're like, I don't want the scar. I'm like, it fades. It will give you a better shape over time.
Yeah. There's so many things you can do about scars now. Just get the lift and be happy because a lot of people that don't get the lift come back and then get the lift later on.
Right. That extra skin, move the nipple higher. Actually, she talks about she chose to have the procedure over her muscle. So a subglandular or subfascial. So she said the surgeon does this frequently, doesn't need to cut into your pec muscle, which is she's super active. She didn't want anything under the muscle. So props. So she went to subfascial, which is a little bit trendy these days. And then I think later on in the article, she talks about using mesh. So the internal bra, Gala Flex, an internal mesh bra that they put on underneath. It dissolves, so it becomes like collagen after 18 months, gives you support because you're not supporting the implant with your muscle. And so she's talking about how she's happy.
I do know in one of the related articles, she says despite her breast aug, she does still plan on having more babies. Would you suggest people that get a breast aug, of course, I know you can do incisions in your IMF to help breastfeeding. Would you suggest they still get a lift or wait for the lift part till you're done having babies?
I mean,
I know what I would suggest, but
what would you suggest?
Have the lift when you're done having babies.
Yeah, especially if you're going to breastfeed.
Yeah, because then they're going to get even bigger and then it's just going to have to redo it.
Yeah, I mean, maybe she has the time and energy and money to redo it, and maybe she's not really sure about she has a 20-month-old. So usually at that point in time, unless you accidentally get pregnant, you're not like, oh, I want to have another kid right now. She's got like a 4-year-old and a 20-month-old.
Oh.
You're just exhausted.
But then in a lift, you're bringing the skin together. You're taking out all the extra skin. Your boobs are getting big with milk. Then you're just getting stretch marks and you know what I mean?
Oh, no, I know. And she has a subfascial aug, so that's also going to interfere with breastfeeding. But maybe she didn't breastfeed her, for as transparent as she is, maybe she didn't breastfeed her other 2 kids and isn't planning to breastfeed her 3rd one if she has it. Or maybe she's 99% sure she's not going to have kids. She's just leaving the option open. Who knows? But yeah, I think if you come in and say, I'm planning to have another kid in the next year or 2, then no. Just wait, man. All right, let's dial into Motiva breast implants.
Motiva.
They do have some nice packaging when you open the implant box.
Their packaging is kind of insane. It's like really gorgeous. And I'm like, I wonder how much money they spend on this packaging.
I know how much they charge me for the implant. So
that's probably where the extra money is coming from.
Right. If they want to send it in a plain old box, that would be great. A cardboard box without some like internal printing and charge me less for the implant. That would be lovely. Anyway, so Motiva implants are silicone gel implants. So there's 2 types of implants out on the market, saline and silicone. Saline are, saltwater filled silicone shells that aren't very popular, but some people like them, mostly patients who've already had saline implants and need a second set. Some of them will choose to stick with saline because that's what they know. I always say the 2 differences are they don't feel as natural because they feel like Ziploc bags full of water. And they also, when they rupture, So that's a 2 difference. They don't feel as good, but when one ruptures, you absolutely know it because the whole implant deflates. Silicone feels more natural, but if it ruptures, you might not know it because the silicone's pretty cohesive these days and it just kind of stays inside the shell. So these are silicone. The gel is supposed to be super cohesive. I think their claim to fame, though, honestly, is that the gel shell interface is tightly bonded, which is interesting because a lot of ruptured implants are related to some sort of breakdown. You create the shell, you fill it with silicone gel, and then you close the back with a little patch. So when we look at the back of an implant, you see like that little circular patch. That is where they've sealed off the implant. And not usually, but you can see a breakdown in that patch area. And that would be like it's a point of weakness for the implant to rupture. Other places that an implant can rupture are as the implant moves around. Is it wrinkling? Certainly a point of contention for saline implants. That wrinkle creates little mechanical wear and tear that leads to a crack in the implant. And then the last thing that we don't like to see in silicone implants is what we call gel bleed. So the silicone shell starts to break down and get sticky and is considered gel bleed and is inflammatory and is kind of gross when we have to take it out. Implants that have been in for a few decades, generally speaking, have gel bleed, but we don't want to see that. So Motiva, their argument is that there's the shell of the implant and the internal gel are more tightly knit, so you can't pull the shell away from the internal gel, which theoretically should lower the rupture rate because there's less friction points for it. And then does it feel more shell gel? Does that feel more natural to you? I mean, I guess so if you're holding it around in your hand. But once it's under your breast tissue, I don't know that you can tell the difference between the shell gel interface and any implant. And then most importantly is the fact that it's got this smooth textured surface, which is, I know, like, what is the word called?
Smooth textured, smooth or textured. Nano-textured.
Right. It's like jumbo shrimp, right? So it's nano-textured.
What? Jumbo shrimp would not be the word I'd use to describe that.
No, smooth textured. It's like they're opposites.
Jumbo shrimp. Okay.
Get it? I'm getting a jumbo shrimp. Never mind.
No. You obviously know this little brain is not on functioning full speed.
It's okay. So it's got
jumbo
this
shrimp.
It has a velvety surface, which is in contrast to a smooth implant, right? Which is smooth. So interesting because we pulled textured implants off the market a few years ago. Allergan pulled their textured. They were macro textured, so you could see the texturing, like very rough outside implant. This is smooth, which is supposed to like give you a thin capsule. It doesn't Velcro to anything. They claim that it has a lower capsular contracture rate because of the smooth textured surface or nano-textured. It's considered a smooth implant by the FDA because the texturing is so small. It's 4 nanometers or micro nanometers or something. It's just small. And then the two styles of implants have different gels in them. So the round is more like a traditional implant with a firmer gel, and the Ergo, which is what our little Lindsay Arnold had in, is a more fluid gel or a more moldable gel that moves with your body. So supposed to act more like breast tissue. If you're interested in Motiva implants, reasons to do it would be that ergonomic, that really soft. They make their specialty, or not their specialty, but they don't make giant implants. They make pretty small implants because they've been around for 14 years in primarily other parts of the world, China, South America, and those places tend to skew smaller implants. So they have, 140, 160, 160, like these tiny little implants. So if you're looking for a smaller implant that you can put under the breast tissue and won't feel like, a ball under there, then these are good implants to use, I think. I think it hasn't been proven, but if somebody has recurrent CapCon, I might consider switching to Motiva implants because of their quoted low CapCon rate. But, again, we just have to wait and see how long the data comes out if that holds up. And then Motiva is supposed to enable you to make smaller incisions, but I don't think that's actually true.
I feel like you could only do that if you could put in like the 140s, but if you're going there and putting in the big ones, you still have the same incisions.
Right. It's related to the size of the implant for sure.
So what does the nano texturing really do for the implant? Like I know that's like their thing. What is that? Does stick better?
No, it's supposed to be anti-inflammatory. So it's supposed to reduce capsular contracture, give you a very thin, filmy capsule, and let the implant move around with you.
Okay.
That's kind of the deal.
I am curious, with only 3 years of data, if anybody has actually gone back in and looked at their capsules and been
They
like,
have.
they have?
Yes. And they
Okay.
say they're thin and filmy like saline capsules. But we've gone back in regular silicone implants and the capsules can be thin and filmy, right? I
Mhm.
mean, I see thin grade 1 capsules all the time. Like,
Yeah.
okay, so you might want to be using a Motiva implant if you have recurrent capsular contracture, perhaps. If you're putting a smaller size implant, because I really do think that that's a little bit what they're famous for, is like the 160cc implant, the little baby implants. They do go up to 625, which is kind of small for a silicone implant. Are they more expensive? Yes. Do they come in pretty packaging? Yes. But I think one of the other things we were talking about is that you're supposed to be able to do a smaller incision with an erg. So this is a round implant and this is an ergonomic. And you can just kind of, I don't know, it's hard to tell, but you can see when I'm holding them
Oh, yeah.
up.
One's less wrinkly.
Yeah. The ergonomic is just softer and more wrinkly, if you will, acts more like natural breast tissue. And so the argument is that you can get that in through a smaller incision. I think you start to have gel fracture and implant problems when you try to squeeze implants in through incisions that are too small. So just
So does the
use,
wrinkly one give you more of like a teardrop shape versus the round
yeah,
one might give you more cleavage?
yeah. So the wrinkly one is more likely when you lay down, the gel moves with you. So it acts more like breast tissue and the round doesn't. So it gives you more of a rounder upper pole look. So if you're looking for that kind of upper pole, what I refer to as the Orange County look, then you're going to go with round. If you want a more natural look, then the ergonomic is where it's at. Feels softer.
And then what are the different sizes? It's like what, demi, mini, and
There are 3 profiles for the Motiva: mini, demi, and full. Full's the only one that makes any sense, honestly. Like full, you understand intuitively what that means. Mini is a low profile implant, and demi, which is probably what this girl had, is a moderate profile. So Goldilocks profile, which is what most people do. And what that means for the same volume of implant, that 265 cc's, we'll just look it up here on the little chart, which is what I generally do. So if she does a 265 cc implant in the demi or moderate profile, she gets 3.8 centimeters of projection. So, almost 4 centimeters. If she does a 265, which doesn't exist, but a 260 in the mini, she gets 2.8 centimeters of projection. So a whole centimeter less of like oomph in that direction. And that's just within the ergonomics, right? So that's like using the softer one. If she does a 265 demi, she gets the same amount of projection for the round one, but when she stands up, she's not losing any of it in the upper pole. And in the mini, in the 265, same thing, 2.8. So for both implant ranges, the amount of projection you get is the same no matter what the cohesivity of the implant is. So you got to pick your profile. I don't know. I hope that helps. I feel like Allergan has like 11 different types and it just gets confusing for the patient. So if you want the softer implant, the reason to go with the rounder implant is maintain upper pole fullness, but you could just change the profile. Or you have really thin skin and you don't want to see any wrinkling, because that's the other complaint. So women tend to complain about their implants afterwards. The kind of like nuances are, I can see wrinkling. Well, if it's just skin over implant, you're probably going to see wrinkling no matter what. So that's one reason. And one common complaint is rippling. It's kind of a known entity. Animation deformity, when you flex your muscle and you can see the implant move, that's the other thing sometimes people get really wrapped around the axle with. If that's going to bother you, then you need to go subfascial or subglandular. But if you're going to put the implant on top of the muscle, then my advice is to not go with a large implant because it's going to sink like a rock in a sock. So don't do that unless you add mesh. And even then, I just think putting it under the muscle holds the implant up more over time. And this is all irregardless of the type of implant. Which brings me to my next little topic, that Motiva, the company itself, is introducing something called Preservé, which is a making an incision, inserting a trocar, which is just like a little tube, and then blowing up a balloon to create the space for your implant, and then pushing the implant through. So a kind of scalpel-ish free breast augmentation.
Okay.
And Brie is like, what?
I'll believe it when I see it.
Well, we probably will see it. I think if you're going to put a small implant, you're going to go subglandular. Honestly, there probably isn't a great reason why you couldn't do it under local anesthetic, right? Or with a little sedation. Make a little
Don't you
incision.
think that'd be really uncomfortable making a whole pocket with a balloon? Like you're literally lifting layers under local. There's no way to go in there and numb.
You could numb with tumescent. And then if you could just get in between the pec fascia and the breast tissue, I think you could create that space.
But if you numb with tumescent, then aren't you just getting a bunch of fluid in there? And don't you want to like suck that back out?
It'll get absorbed. You can't put too much fluid in there. I just know that's how they do it. The jokers that do the awake uppercups. They don't. They don't.
Is that what they call it? Uppercup?
Yes, when they do the awake fat transfer to the breast.
Wow. Never heard it called that.
Yeah, that's what it's called. Anyway, the technique is to put a little bit of tumescent solution in the breast, but not all throughout the breast, just below, kind of in that plane between the muscle and the breast tissue. And then you jam fat in there and...
So I see that because it's not like an implantable device, a foreign body. But like with tumescent, like when we do the alloy, that makes sense to me. But just an implant and infusing that area with tumescent.
And then blowing up a balloon to create the space.
Okay, I guess I'm just wrapping my little brain around it.
I don't know. I mean, it's kind of crazy, but we'll see.
I guess it depends how much tumescent you're putting in there.
Yeah, and how much that balloon is going to expand, right? Like if you're stretching 200 cc's volume, sure. If you're going to put a 400 cc implant in there, I'm going to guess no. And just like anything else we do, some people will do awesome and like not flinch, and other people are going to be like crying the second you touch them. So trying to figure out who's who is important.
Yeah. Just go up and give them a little flick. Sorry, did that hurt? You're not a candidate.
Yes, that's right. If you're going to be super nervous, then probably not going to work out for you. So yeah, that's coming next year. We're thinking March. The Preservé is going to get launched. They got to figure out how to...
Can't wait to see that.
I'm not going to Costa Rica to see it happen. I'll tell you that.
If you do, you have to take me.
I know. But you don't go to like the beaches in Costa Rica. So it's not...
that's what they think.
Can you see us backpacking around Costa Rica trying to figure out where's the beach?
Oh my God, it'd be so good.
On the go with Dr. G and Brie.
Yes. We could get little restore bikinis.
So moving back to Motiva. Can you tell somebody has Motiva implants in by looking at them? Absolutely not.
No.
You can't even tell if they have saline in, to be honest.
No.
So
half the time we go in there, I'm like, oh, these are saline.
Right? Yeah. You get to see and feel the Motiva implants at your consultation if you're interested in going that route. I do offer more, mainstream, traditional, basic bitch implants, aka Natrel. I like the Inspira Natrel implant. I mean, it's a good implant. It's been around for a long time. Yeah, it's smooth. It cooks. Yeah. So I'm excited for the Preservé option because I think some people might be interested in doing a breast augmentation under sedation or local anesthesia if they're doing small, tasteful 200, 160 cc implants. And that will be something we'll be able to offer.
Yeah. I'm here to see it.
I mean, it's kind of like alloy. Like we weren't sure what the market was, and there's definitely a market for it. People like non-surgery surgery.
Yeah, the easy lunchtime procedure.
Right. Exactly. So if you're interested in learning more about breast augmentation, Motiva implants, Natrel implants, Mentor implants, who actually came out with an even larger breast implant. They have 1,000 cc's. Yes. But for breast reconstruction, it is crazy. Come give us a holler and tell us what you think about Motiva implants and whether you would be interested in doing an augmentation under local anesthesia or if that sounds awful to you. Let us know.
Yeah. Come on in and feel them out yourselves.
Yep.
But we are scrubbing in
to scrub out. If you're listening today and have questions, need info about scheduling, financing, reviews, or photos, check out the show notes for links. Restore SD Plastic Surgery is located in La Jolla, California. To learn more about us, go to restoresdplasticsurgery.com or follow us on Instagram at RestoreSD Plastic Surgery. If you enjoyed this episode, please share it and subscribe to All the Bees on YouTube, Apple Podcasts, Spotify, or wherever you like to listen to podcasts.